హార్టీ వెల్కమ్ టు ఆల్ ఆఫ్ యూ. మీ విలువైన సమయాన్ని మాతో పంచుకోవడానికి వచ్చిన మీ అందరికీ హృదయపూర్వక స్వాగతం. అండ్ ఇఫ్ యూ లైక్ ద కాంటెంట్ ప్లీజ్ డూ షేర్, లైక్ అండ్ సబ్స్క్రైబ్.
మన సిటీస్లో పొల్యూషన్ లెవెల్స్ డేంజరస్ రేంజ్కి వెళ్ళిపోయాయి. ఇది జస్ట్ ఎన్వైర్న్మెంట్ ఇష్యూ కాదు, దిస్ ఇస్ అ పబ్లిక్ హెల్త్ క్రైసిస్ బాస్. సో ఈరోజు మనం ఈ గవర్నమెంట్ సోర్స్ మెటీరియల్ నుంచి ఇండియా ఈ మ్యాసివ్ క్రైసిస్ని ఎదుర్కోవడానికి ఏం చేస్తుందో వాళ్ళ కాంప్రహెన్సివ్ స్ట్రాటజీని స్టెప్ బై స్టెప్ డీకోడ్ చేద్దాం. లెట్స్ డైవ్ రైట్ ఇన్.
సో ఈరోజు ఎక్స్ప్లెయినర్లో ఈ 5 కీ ఏరియాస్ కవర్ చేద్దాం. ముందుగా అసలు ఈ సైలెంట్ పబ్లిక్ ఎమర్జెన్సీ ఏంటో చూద్దాం. తర్వాత గవర్నమెంట్ స్ట్రాటజిక్ ఫ్రేమ్వర్క్ ఏంటో తెలుసుకుందాం. నెక్స్ట్ గ్రౌండ్ లెవెల్లో కీ ప్రోగ్రామ్స్ ఎలా పనిచేస్తున్నాయో చూస్తాం. దెన్ నేషనల్ స్కీమ్స్ అన్ని ఎలా ఇంటిగ్రేట్ అయ్యాయో చూసి ఫైనల్గా యూపీఎస్సీ ఆస్పిరెంట్స్ కోసం ఒక స్పెషల్ అనాలిసిస్ చేద్దాం. రెడీయా?
ఆల్రైట్, లెట్స్ జంప్ స్ట్రైట్ ఇంటు సెక్షన్ 1, అ సైలెంట్ పబ్లిక్ ఎమర్జెన్సీ. అసలు ఈ ఎయిర్ పొల్యూషన్ వల్ల మన హెల్త్ మీద ఇంపాక్ట్ ఎంతో డీటెయిల్గా చూద్దాం. రిమెంబర్, ఇది మనం చూసే స్మాగ్ గురించి మాత్రమే కాదు. ఇట్స్ అబౌట్ వాట్స్ హ్యాపెనింగ్ ఇన్సైడ్ అవర్ బాడీస్,
Okay, so here's the thing. The government's official stance is super important to understand. Vala press release prakaram, air pollution walla direct ga ee rogam vachindi ani chepadanki conclusive data leduvanta. But, and this is the key phrase to remember, it's a confirmed aggravating factor. Onto NT. Simple ga. Already onna breathing problems ni, respiratory issues ni, idi inka worse ga tiyado chestundi. It pours fuel on the fire,
Just look at this visual. The difference is, well, it's stark. On the left, you've got healthy lungs, easily processing oxygen. Kani right side chudandi, pollution ki expose ana lungs, illa strugglite nayo. COPD, asthma lanti chronic respiratory diseases, pollution vala chola aggravate utanayo. This isn't a small issue. It's a serious concern for millions of people. So the problem is clear, right? It's serious. Now, the big question is, how exactly is the government tackling this? Let's get into their strategic framework. This is basically the master plan, the blueprint for the entire national response.
And this is the core idea right here. Government single scheme to kadu, they're implementing a multi-sectoral strategy. Ante enti? It means they know this isn't a problem for just one ministry. Health, environment, transport, urban development, anni departments kalisi oka team ga pani chestunayi. It's an all hands on deck kind of mission.
Okay, so this multi-pronged approach is built on these 5 key pillars. Think of them as the backbone of the entire strategy. First up, we've got a technical expert group under the DGHS to provide scientific backing. Second, a dedicated national program, the NPCHH. Third, and this is key, state-specific action plans. Fourth, a proactive early warning system from the IMD. And finally, the masterstroke, linking all of this with existing national schemes. Now, let's break each one down. Okay, so we've seen the framework, we've seen the pillars. But the real question is, how does this all work on the ground? Let's see how these policies translate into actual action.
At the heart of this strategy is the NPCCHH, the National Program for Climate Change and Human Health, launched back in 2019. Dini main focus, Intante, it's not just about making rules, it's about building a resilient society. So awareness plus capacity building plus preparedness, me focus. A complete 360-degree approach, really.
And look at this number, 36. This isn't just a number, It represents a massive pan-India commitment. Prati state ki, every single one of the 36 states and UTs ki, wala local needs ki taggattu dedicated action plan undi. Center-state coordination clear ga kanipistundi ikkada. No one gets left behind.
When they say capacity building, they really mean it. It's not just for show. Look at this. It's a complete top-to-bottom approach, from the high-level medical officers making policy right down to the ASHA workers in our own streets, and Hyderabad ki specific training modules developed Chesaro. And it's not just in Hindi and English, but regional languages too, so everyone understands. Best part? They have customized materials for vulnerable groups like children and women. Now, that is what you call thorough planning. Okay, this part is a real game changer. It's about being proactive, not reactive. So the IMD, the Indian Meteorological Department, provides daily air quality forecasts. So IMD forecasts bastainte city authorities mundugune AQI alerts issue chestaru. And that means hospitals, schools, and vulnerable people can prepare in advance. This is proactive health preparedness in action. Now we come to what I think is the smartest part of this entire strategy, integration. It's one thing to have schemes, but connecting them, that's where the magic happens. Let's see how they're creating a truly unified front. This table just connects all the dots perfectly, right? Chusandi, you have the National Clean Air Program, or NCAP, cleaning the air outside. Then you have the PM Ujwala Yojana cleaning the air inside our homes with clean cooking fuel. Add to that the Swachh Bharat mission promoting a cleaner environment overall. All these pieces work together, integrated with the NPCCH, to form one powerful unified front. It's a 360-degree attack on pollution.
All right, UPSC aspirants, this section is for you. Time to connect the dots for your exam. Let's talk about how to take all this information and turn it into high-scoring points in your answers.
So, for your GS2 paper, Public Health Governance, this is pure gold. Center-state coordination on your item, okay. But if you back it up by mentioning the 36 state action plans, that's a game changer. Similarly, when you write about evidence-based policy, make sure to mention the role of the technical expert group. It shows the examiner you know your stuff inside and out.
And what about GS3? GS3 Low Environment Health Nexus Question vaste, NPCHH plus NCAP plus PMUI integration mention cheste, answer depth perigipotundi. Seriously. Other candidates might just talk about pollution, but you'll show the examiner you see the bigger, integrated picture. That's how you write an answer that truly stands out. Okay, I know, that was a lot of information. Mind block aipovachu, right? How do we remember this entire framework, especially under exam pressure? Don't worry, I've got a couple of simple mnemonics that will help you recall everything.
Here's the first one, health air. Just remember this phrase. H for health advisories, E for expert group, A for awareness, L for linked schemes, T for training, the second H for human health focus, A for action plans, I for IMD early warning, and finally R for resilience building. See, health air ani gurtupettukunte entire framework recall avutundi in seconds.
And for a quick recall of the course strategy, remember CAPS IM. That's Climate Program, Advisories, Pollution Control, State Plans, IMD, and Multi-Sectoral. CAPS IM ante Government Pollution Health Strategy full cover. And for the diseases, simple. CRA, COPD, asthma, respiratory vulnerability, and air pollution aggravation. Easy peasy.
So, at the end of the day, what's the big takeaway? Clean air is not just about the environment. It equals preventive healthcare plus smart policy coordination. Air pollution ni tackle chedamonte, it's a preventative governance approach. It's about saving lives before they're even at risk. The real question is, how can we, as informed citizens, contribute to this mission? Something to think about.